Vaccines will soon be required for some workers in Colorado. Masks aren't coming back yet, but they could be.
Dropping out gave Simone Biles a new perspective, and now she's saying thanks for the support.
I mean, this group meant so much to many Black Americans, just as the Neighborhood 5 Points means to us.
There are new pieces of history at Denver's library telling the story of the Black Panther Party.
Denver breaks a record, one that stood for nearly 150 years after another day in the 100 degrees. 9 News at 9 starts now. Vaccines will soon be required for all workers at Denver Health and the UC Health system, and we may soon see more counties in Colorado put indoor mask mandates in place. More on that in a moment, but first to the new vaccine requirements. UC Health says it will be requiring all of its employees to get the COVID vaccine by October 1st.
9 News reporter Luis De Leon joins us now. And Luis, UC Health isn't the only local hospital system requiring this.
Yeah, that's right, Alex. Kim, I reached out to the local hospitals to find out if anyone else is doing this. You can see right behind me, 4 say they are, 3 are not. 9 News legal analyst Whitney Traylor says these hospital employees really don't have much of an option after their employers require it. It was a big announcement from UC Health.
Vaccination is an incredibly important tool for us to utilize.
They'll be requiring all employees to get the COVID-19 vaccine, in part due to the rise of the Delta variant. In UC Health's case, the deadline is October 1st. If you're not exempt and you refuse to get it, the hospital says you could face a penalty, including up to termination. A spokesperson says they'll monitor and reach out to employees that are still unvaccinated by around September 3rd. Elsewhere in the U.S., protests have happened recently outside of major healthcare providers from Boise, Idaho to Houston, Texas. Hospital workers against a vaccine mandate for a number of reasons. Dr. Michelle Barron with UC Health says they're prepared for any concerns from unvaccinated employees.
So I anticipate there'll be some individuals that, again, may choose to make alternative plans for what they do. But we're hoping that they understand the intent at the end of the day is for their safety.
And 9 News legal expert Whitney Traylor says he expects to see battles in court.
We all should expect to see litigation throughout the nation.
And while an employee could fight back on it, it's tough to really make a case, let alone win.
The short answer is an employer does have the right to mandate a vaccine based on the case law that is out now.
And the right to fire. He says public employees, so a city employee, for example, may have a stronger argument, but it's still probably not enough.
These employees are, in Colorado at least, if they don't have a contract, which most employees don't, they're at-will employees. Now, that doesn't mean that they can be fired for any old reason. The catch-22 is that the employer has to provide a safe environment.
Now, I was told today a vast majority of the employees at some of these healthcare systems requiring the COVID vaccine are vaccinated. For example, almost 85% of employers are vaccinated at UC Health. The hospitals tell me that there are exemptions that include medical or religious reasons. Kim, Alex.
A handful of hospitals today. Something tells me that's just the beginning.
Absolutely.
The CDC is recommending that more people go back to wearing masks indoors, and now that guidance also applies to counties around Denver. The map is helping us track the areas where transmission of the virus is listed as high or substantial. Currently, that's 42 of Colorado's 64 counties. Orange is substantial, red is high. Denver, Adams, Arapahoe, Jeffco, Douglas, Broomfield, and Boulder are all listed in the orange category. Based on the new guidance, the CDC is recommending people wear masks indoors in public places, even if they're vaccinated. So far, no counties in the Denver area have issued new mask rules. So what exactly does high or substantial transmission mean? 9 News reporter Jennifer Meckles looks at the current data and explains we are still in a much better place than we were months ago.
We are about to throw a lot of numbers at you, but keep in mind, as you're looking at these numbers, it's not just the numbers today, but how they compare to what we have seen before. And the CDC is really focusing on transmission rates. Substantial, that's the orange, that means your county has a positivity rate above 8% or has reported 50 to 100 cases per 100,000 residents over a 7-day period. High, the red, that is even worse. Your county's positivity rate is above 10%. Or it's reporting 100 cases or more out of every 100,000 people. How about some context for Colorado? Colorado as a whole is sitting just below a 5% positivity rate. On this map, it is the red line tracking the positivity rate. against all the testing. Yes, that is higher. It's about double from where we were a month ago, but it is still below 5%. That is the threshold experts say that we need to stay below in order to keep COVID under control. Colorado's 7-day average, 643 new cases a day. In Denver, that's 61 cases a day right now. But it is important to point out that we are not testing nearly as many people as we once did. This is back to our testing map now. During the spring peak, that is when the state's positivity hit 6.5%. So we're talking here on the positivity, but we were testing twice as many people as we are now. And that was about 1,700 new cases a day at that point. Or if we go back to winter, where we were hitting a nearly 13% positivity rate, again, that red line right there, but we were testing even more people at that point. In November, we were averaging as high as 5,396 cases a day. All right, so another important metric is hospitalizations. We've been below 300 for about a month now. Compare that to our spring peak, though. We were hitting the mid-600s, or our winter peak, 1,800 hospitalizations a day. So what does this all mean? I know it's a lot of numbers. Yes, our positivity rates are going up, but they're going up slower than they have in previous peaks. And our hospitalizations are not going up quickly. These things are good news in all of this. Even our governor has called hospitalizations an important metric to watch and to react to if those start to jump fast. So yes, things are changing. Got to keep an eye on them. But it's helpful to have the full scope.
Right. I mean, remember how we wait forever for a test? People were for the longest time, and you'd see signs, COVID testing here and there. So you have to think about what you're looking at. For a while, it was positivity rate only, and then hospitalizations, and now it's hospitalizations that we really need to focus on.
Everybody will give you something they feel is the most important thing to watch.
Okay.
It's helpful to have all of this in front of you.
Okay. All right. Either way, we're kind of in this funky place right now that people are pretty worried.
Yes.
Okay. All right. Thanks, Jenny.
Masks are on again at the White House. President Biden exited Marine One wearing a mask today, and he walked right into the Oval Office without taking it off. The White House is now requiring masks for all employees. Tomorrow, the president is expected to announce that all federal workers need to be vaccinated or wear a mask and receive regular testing.
Decisions on masks and other COVID precautions will be up to schools and their districts this year. Athletes in some districts may face stricter rules. Aurora Public Schools says middle and high school athletes must be vaccinated or be tested for COVID every 2 weeks if they're going to play a sport. Students will also have to show proof of vaccination or a negative test before the season begins. Unvaccinated students will have to show negative tests every 2 weeks. APS told families transmission among athletes is higher because they're competing next to each other and breathing heavily. High school athletes had to wear masks during some sports last year. CHSA says decisions this year will be up to local leaders.
Larimer County has suspended the search for a woman still missing since last week's flooding in Poudre Canyon. So far, Diana Brown from Texas has not been found. Rescuers found and recovered the remains of the 3 other victims. They identified the third man as 85-year-old Richard Brown of Bellevue. Neighbors knew him as Dick and say he was a retired Air Force colonel. Larimer County says 62 rescuers spent more than 850 hours looking through debris to find the victims. Flooding July 20th destroyed 6 homes.
Police in Cherry Hills Village are trying to find a man wanted in a deadly hit-and-run crash that killed a woman from out of town. Police say the crash happened a little after 6:30 Monday night near Cherry Hills Country Club. The crash happened on University, just south of Hamden. Police say the crash killed Stacy Pepper from San Francisco. She was in town visiting family. Police are looking for a person of interest they say ran from the crash. They say the truck of the crash was stolen out of Jefferson County and that the suspect and the truck are tied to a burglary in Arapahoe County. Police say the man may have an injury to his left arm. If you know anything, please call police.